Hi there. Thanks for coming into the clinic today. So I got the results of your blood work and it looks like you have something called hypothyroidism. Earlier in our assessment, you were complaining about fatigue, weight gain, and hair thinning. All of these are symptoms of hypothyroidism, so we know the source of your concerns. There are many moving parts with hypothyroidism, the first being thyroid stimulating hormone, also known as TSH, and this tells your thyroid to make more thyroid hormone that's called T3 and T4. T3 is the more active of those two. Your thyroid gland is not making enough of that for some reason, and your TSH is trying really hard to help fix that. But without enough thyroid hormone, your metabolism is slower than usual. But luckily, there's a medication called levothyroxine that can help replace that hormone that you're missing. The other name for this medication is called Synthroid. Synthroid boosts your metabolism through its mechanism of action. The medication starts off as T4, and enzymes in your body convert it to T3. The T3 binds to your thyroid hormone receptors in your cells, and it actually works with your genes to help increase your metabolic rate, which should help with the symptoms that you're concerned about. Synthroid comes in a pill, and you take it once a day. It is first thing in the morning on an empty stomach. It's absorbed in your small intestine, and most of the drug is actually bound to special protein in your blood, and the part that is not bound is actually what is working on the different areas of your body. I don't want you taking it with breakfast because the calcium and the iron in your food can actually bind to it and leave less available Synthroid for your body to work with. Like I said earlier, it is metabolized through your special enzymes that convert it from that T4 to T3. And this metabolism takes place in all of the tissues in your body. It's not really focused in your liver like other drugs are that are only metabolized there for the most part. Synthroid exits your body through renal excretion, so your kidneys converting it to urine, and also through your GI system as bile. It's pretty slow to leave your body and can last in your system for about 7 days after you take the medication. Synthroid can come with some side effects if you are overcorrecting your thyroid hormone, which would take you from hypothyroidism to hyperthyroidism. You could have side effects that are the opposite of what you're having right now, such as heart palpitations, anxiety, trouble sleeping, and weight loss. This can typically be addressed through adjusting the dose of your Synthroid medication. Please reach out to us if you have any unusual symptoms. And while it's rare, it is possible to get a rash from the Synthroid or even be allergic to it. When it comes to treating children with Synthroid, it is weight-based. Most kids are growing very quickly at certain ages, so it's important to have regular follow-up visits to make sure they're getting a proper dose for their current weight. If you have a child that's growing really quickly and you're basing the dose off of a weight from last year, you may not be giving them enough thyroid support that they need, and it can actually affect the development of their brain and their body if they don't have enough. And for little kids that are too small to swallow any pills, it is okay to crush them. When we're treating elderly patients with Synthroid, I like to use the guidelines start low and go slow. Elderly patients can be more sensitive to medications as their body is slow to process it and to eliminate the drug. This puts them at risk for overtreating them accidentally and putting them into hyperthyroidism, as we discussed before. This is particularly important with older adults who have heart issues because palpitations in their heart can be a side effect from hyperthyroidism. Other issues that could come from this could be weight loss, trouble sleeping, or even brittle bones. In conclusion, right now your thyroid levels are too low. A medication called Synthroid or levothyroxine can replace that hormone. This will boost your metabolism and hopefully make you feel better from the symptoms that you're experiencing. There is a risk that Synthroid can make your thyroid levels too high, which can lead to different symptoms. We'll have regular follow-up appointments to make sure that your thyroid levels are doing well and that you're not having any unwanted side effects. What questions do you have for me?